also would like to introduce Victoria Beeler, who's here with me, and she'll be chiming in. Victoria has a background in basically benefits management with and on the sales side, so she's very happy to be on the advocacy side. But as far as the individual Medicare and also disability, so she's got excellent background and experience, so she'll be joining us. So tonight, first of all, if you have a question, it's 7 o'clock at night, so it's, for me to be talking at you all, we want to keep everyone awake. So, and keep myself engaged as well. So feel free to ask questions, but we'll try to keep things on track. And, but it's fun to be here in the Mark Twain library, which is, was reading his book and kind of reading up on some funny quotes of his. So hopefully we can make this kind of fun too. So this is the big talk. There's the Medicare open enrollment that's going on now, which is October 15th to December 7th. So we're getting a ton of calls because there's been a lot of changes that have taken place. So people are very aware that they need to maybe change their plans or at least make sure that they have the right plan for 2025. This is the same for the Affordable Care Act, ACA, Obamacare, what's marketplace insurance coverage. There's all different sort of ways people identify with their individual and family health insurance that they get through either the state marketplace or they get it directly through insurance companies. So today we'll talk about basically, I'm just looking at my slide. We'll be talking about sort of making sure you understand different ways of choosing your plan and information about subsidies and things of that sort. So you heard a little bit about our background, but just to tell you where we're coming from, we do not sell health insurance. We are healthcare advocates and advisors. And background, as you've heard, my nursing background. I told you Victoria's background. We also have other people who are claims managers and deal with the long-term care insurance side. And then we've got other team members who have home care and assisted living experience. So when we come into talking about your insurance, we're not just talking about the benefits, the cost, we're really talking about the experience as well, which is so important because you need to know, sort of have an idea as to what you expect in the next year. If you have any anticipated surgeries or change in your prescriptions, that's very important to consider. So we'll look at that whole sort of picture as we're going through. Okay, so as I said, the agenda, basically assessing anticipated services in 2025, looking at comparing and choosing your plans, and then enrollment confirmation. These are the areas where we have people don't think they enrolled in a plan and they find out after the fact that they didn't get confirmation. Okay, so that's not looking right. Okay. All right, well, I'll just keep going. Okay, so we're looking to access services and RX changes. So when we're looking at services that are coming up, you got to look at anticipated services like medical visits. You want to we'll talk about network status of doctors, but if you're going to go to a rehab, are you having surgery? Will you be having a hip replacement? Will you be going home after that hip replacement? Might you be going to a rehab or an acute rehab? That's where we have to talk about your network. Is that facility, that place going to be in network? Will it be approved? Oops, sorry. Diagnostic tests, that can be very expensive. You need to know which providers you need to go to get your blood work done. What's your experience been this year? Have you been restricted from going to one place where you want to go to another? I was talking about planned surgeries. This is, again, when we're talking about planned surgery, it's not just about the doctor who's doing the surgery. It's about who's the anesthesiologist, are they in network, the outpatient center that maybe you have that surgery. What if you're an overnight stay? Is it a different type of deductible that's applying? That's more in the Medicare space, but it may also apply to your plan. And then, as we were just talking, prescription drug coverage, and then preventative care. What are those benefits, and how will the plan work? So with in and out of network, so basically we're talking about different plan options, but if you go to doctors who do not accept your insurance, then that's considered out of network. And you'll have to determine whether or not your plan offers those benefits, and you can choose it. You may want a more restricted plan that's, you know, the network's not as big and it may cost less. I'll dive into that more. Preventative care, those are sort of the mammograms, colonoscopies, you know, getting, depending on if it's vision or dental and things of that sort, there's different benefits that may be included in your coverage. But basically the checkups, the annual checkups as well. You still have to find out what is included in what's covered under the preventative care and what's not. For example, if you've had a colonoscopy and they found something the last time you had it 5 years ago, when you go back to have it again, it may be billed under diagnostic. So you need to get clarity where you go in expecting that this is going to be covered and you're not going to pay anything, and then you get the $3,000 bill. And that's where you need to be proactive either before, or if you get that bill, you can go back and challenge it. Okay, search and compare plans. So where can you do this? You can go to Access Health CT. We're talking about Connecticut, but all states have different marketplaces. And so you can go to healthcare.gov if you're in a different state to find out where you should go to the marketplace where you actually can search the state plans. You can go to a broker or an insurance company directly. If you want advice from a broker, just make sure that they have access to or are selling more than one plan, because some brokers only represent one company. So, you know, that's what you'll get, and you might not realize it. So if there's other options in the state, you want to have a comparison. You want to know what your options are. Calling the insurance company directly. If you don't qualify for a subsidy under a marketplace plan, which is, Victoria's going to talk about that. A subsidy is where you're lower income and you may get a government discount on your premiums. If you don't qualify for that, then you might want to go to the insurance company directly. For example, under Connecticut, they have a wider network of providers under their plan that you can get directly. It's called a solo plan. So people who are going to have to pay anyway for a higher premium might want to go and look at that option. They also have a network too, that includes New York and some of Massachusetts and Rhode Island. Okay, I'm going the wrong way. Oh, and then us, Healthcare Pathfinder. So I'll just throw us in. So we are a consulting firm, so people will hire us and pay our fees. We do not sell insurance. So on exchange, I was sort of just talking about this. So on exchange marketplace, and you'll see that when you're doing research, if you're going into the system, you may not know enough to be asking about the on exchange, off exchange. So the off exchange don't have a subsidy, and that's where you would go to a broker and you may get a larger network and there's no subsidies. The on exchange is government. When you go into, there may be limited networks. And again, we'll talk about the subsidies in a minute, actually. Yeah, so it's just very important to understand the difference here. And as far as making your choices, when you go into the marketplace, it's a little bit like going through Social Security when you're going on to Medicare, which most of you probably can't relate to because you're younger. But you have to put in your Social Security number. They will ask you, if we can track your income and things of that sort. When you go directly to the broker or the insurance company, they're not going to be talking about anything related to your, they will ask for your Social Security number, but they're not going to look at your financial background. So I'm going to let Victoria talk a little bit about the subsidies and all that.
So I'm going to just back up half a second, because when I've had conversations with people, they said to me, I don't understand what a subsidy is. What does that mean? So a subsidy means that the government is subsidizing, is helping you pay your premiums. And it's all based on your age, your county, and your income. So if you are aging off your parents' insurance and you're age 26 in the state of Connecticut, and say you don't have a job, you are entitled to get a subsidy from the government. And depending upon what your income is, depends on the subsidy level that you get. And so I did a little research on the different levels, and you can from age 26 going up to age 60, where I stopped, where you can actually go up to age 64, because then at 65 you're eligible for Medicare. And the older you are, the greater the subsidy is in the state of Connecticut. And obviously the less income you make, the greater the subsidy is. In the state of Connecticut, there's basically two insurance companies that sell individual plans. One is Anthem Blue Cross Blue Shield, and the other is Connecticut. They both have a program called Covered Connecticut, which starts at an income level in 2025 of $26,355. So to be eligible for a Covered Connecticut plan, which is not Medicaid, below that threshold is called a program in the state of Connecticut, Husky, which is Medicaid, which is free insurance. And that's a very limited network of doctors, but it is totally free. Connecticut came out last year with a plan called Covered Connecticut, which fully subsidizes your insurance, but you have to be on the plan that they dictate, which is a silver level plan. And it's actually a very nice plan. And it includes not only your premiums, but it includes your co-payments and your deductibles as well. So in reality, you don't pay anything for that insurance, and it has a larger network than the Husky network. So you have access to more doctors.
And there, just to give you an idea, I think the threshold, you have to be making more than about 25,000, and then you've got a level where it caps off. So you can't, if you're below 25,000 a year, then you're Medicaid, Husky, but you have to, and it's hard to kind of work it out.
Level, that's correct. And so depending upon how many dependents you have in your house, depends on the level. So one person in a household, if your income is $26,355, you're eligible for that Covered Connecticut. And it goes all the way up to 8 dependents, and then your income needs to be about $88,000. Otherwise, you're defaulted onto the Husky program. So I'm sorry.
So if you were in husband and wife, you can do separately then, based on your income, or you have to do a good joint?
You do it jointly, especially if you file your taxes jointly.
Okay.
And that's what
It's based on household.
household.
Okay.
So even if you are the parent and you have children under you, they count as dependents. So they help increase your subsidy level. So does anybody else have any questions on the subsidies? It's kind of a little confusing, there's different levels, but before we go on to the next topic, so, go ahead.
So to get a full subsidy, you have to make at least $26,000 a year.
Now, this is for the Covered Connecticut program.
Right.
Yeah,
Yes.
so it's sort of,
And
there's
then what's the
different
top,
thresholds.
if you're, say you're solo in a household?
But then if you make 28,000, then you're off the Covered Connecticut and then you get a subsidy. So, and it depends on your age, how many dependents, there's a lot of things that are factored in.
So it's a pretty tiny window.
It's a tiny window, yes it is.
Okay.
And all of the insurance companies offer a Covered Connecticut plan, which is all of them, which is Anthem Blue Cross Blue Shield and Connecticut. Okay, so I'm gonna let Ann take back over now.
The other important thing which we've experienced is when you go in and you're putting numbers in, there's a lot of questions about how your income is made and your employer, and so it can be very confusing. And when you're talking to the Access Health people, they can help you and tell you where to put things, but they can't coach you and tell you how much income and what to do to qualify. So we did a quote for someone last year, and it showed that they would qualify for the Covered Connecticut, but then when we were going through to do the enrollment, it showed that she didn't qualify. So there's definitely a fine line.
Does the government, for the Husky plan, just leave it up to the doctor's discretion as to whether or not they want to accept low-income patients, or is there a requirement that doctors, have to accept a certain amount of patients?
Right, well, some doctors can not accept insurance at all, so, but they definitely have limits on the number of Medicaid patients they have, and it can be very limited as far as finding providers. For example, dermatologists might be, if you're down in Norwalk, you might have to go to Danbury to find a
But doctors can
dermatologist.
just opt out, like even if they accept insurance, they can just be like, I accept insurance, but I'm not going to accept Husky.
Exactly,
Okay.
yes.
And the reason they wouldn't do that is that Husky doesn't repay them as much as regular insurance.
There's that, and there's also, it's the management of care and decreasing their risk and their time management with potential patients that may have significant health issues.
Yeah.
Clarissa, do you have anything to add to that?
Nothing.
Okay.
It's tough.
It is. So also just to give you, and I won't go into too much details with numbers, but they are increasing, they did get approval to increase the premiums again because the healthcare costs had gone up, and so the government, they have to ask for, the insurance companies have to ask for approval from the state to increase the premiums, but they didn't go up as high, and I'm worried I'm going to misquote it, but they had gone up, it basically says the original average rate increase of 8.3% has been reduced to 5.9%, which is a good thing. So at least we're not going up as high as it did last year. And it varies on the type of plan as well. So I just wanted to share that with you. And actually, just even going back to, I was talking to someone the other day, actually it was a nurse, I was reading an article, and we were reminded and reminding other people that prior to the Affordable Care Act, there were people who couldn't get coverage at all due to pre-existing conditions. So it's fine if you're healthy and you say, it's just not fair, I'm paying for all these people who are sick. That can change so quickly. And I think back to, prior to the Affordable Care Act, fortunately, Connecticut had a reinsurance program that people could go on, but the premiums were very high. But it was, for example, a client, her spouse had passed away, and COBRA had ended. I would speak through her husband's benefits, that had ended. And so she had 3 daughters, so she and her 3 daughters were applying for insurance, and 2 of them didn't qualify because one had a concussion and one had had knee surgery. And that's why they were denied. And so they had to go to this reinsurance program to get covered. But I had many clients in Arizona, or they were coming in from out of the country, moving back to the States, and they were like, what state do I move to? So it's, when we think about the cost, I know it's difficult, but you kind of have to remember that. And even with Medicare, there was no prescription drug coverage prior to 2006. So I know it's very expensive, so that's why at least the government's trying to help in this regard, but it can be confusing. So just ask for help and talk to the Access Health support and any other like state resources, especially if it's Medicaid as well. And I'm going to go on. So, and it's not just about the money savings. I mean, that's so important to be understanding what your health is and thinking about the experience of paying bills. And I like to talk about adult children. So if you're a parent and your children are old enough, they're beyond the 26, they can't be on your plan anymore, and they're not working. So they go off and find another plan and they're like, Mom, Dad, I'm fine, I have my own coverage. Not to realize that they are on, say, Medicaid because they don't have income. So when something significant happens, we have a client up in Vermont, 34-year-old who had multiple head trauma. He ended up in the hospital also with no power of attorney, so the parents couldn't talk on his behalf, but also on Medicaid, and they couldn't take him. He wasn't eligible to go to this rehab because they didn't have any Medicaid beds. So often I talk to parents about that, to seriously think about maybe paying for their child's insurance until that they can maybe get on a better plan. But it's just important to know because people just don't think about that. So the different types of plans. So the HMO, this is kind of cute, but only has in-network. You're gonna have out-of-network is for emergency only. So if you go to another doctor who doesn't accept insurance, there's no claims to file to get reimbursement. PCP is required and referrals are required to go to a specialist. With PPO, that's sort of you can go to any doctors that are, if you have United Healthcare, for example, I should use a different plan, Anthem. If you go to you have the ability to go to anyone within the United Healthcare network. That's the PPO. That doesn't mean you can just go to any doctor who accepts insurance but doesn't accept, say, United Healthcare. So that's where the out-of-network benefits come in. So with those plans, if you go to a doctor who, say, doesn't accept United Healthcare, but they will file to the insurance company, you can bill it to your United Healthcare out-of-network benefit, which is another deductible, and I'll get into deductibles and another out-of-network, out-of-pocket maximum. And then the POS type of plan is sort of a hybrid. So the more restricted type of network and emergency only. PCP may or may not be required, and that's the EPO actually. And then you don't need a referral to go to a doctor who's in network. Okay, deductibles. So deductibles are, and this may be very basic, but nowadays people choose their plans often, hopefully not because of premium, but the next thing you look at is the deductible. If you know that you're gonna be very healthy next year, you're expecting that, then often what people do is get a high deductible plan, maybe a $6,000 deductible plan, because the premium will be lower and their risk will be lower, meaning that they will take more of the risk on and pay out of pocket to meet the deductible before the plan starts to pay. So what's interesting is it used to be when you look at a plan with a high deductible versus a plan with like a lower deductible, say $3,500, the premiums used to be really different. And now they're a lot closer. So it's a lot harder, so you really have to go in and look at the benefits more, and I'll sort of show you that, to figure out what's the experience going to be and where are those costs going to come in. So that's where sort of co-pays and co-insurance come in. So if you choose a plan that has co-pays, that's when you go to the doctor. So you may have a high deductible, but you may have co-pays to go with that. So when you go to the doctor, you pay $20, or a specialist, you pay $40. That's the copay. Those plans tend to have higher premiums because you know what you're gonna pay. They sort of understand what the costs are gonna be. It's a little more comfortable. It's a good type of plan for adult children or children who are going to doctors on their own, because then they know that's what they all have, that's only what they have to pay. And they're not gonna get a bill in the mail that they're not gonna, they don't pay, or we all forget to pay, or we look at it and say, is that a right amount? And you pay it, but then you get another follow-up bill. So that's what copays are nice from that experience. Also, very good if you do go to the doctor a lot. It's a lot easier to have that copay or maybe a lower deductible. And then the co-insurance is you meet your deductible and then you pay a certain amount of out-of-pocket amount. So you pay 80, they cover 80%, you cover 20, and then it goes to an out-of-pocket maximum. That's the maximum amount you'll pay out of pocket. That's very confusing, but when you see your plan, it's very important to understand your in-network and your out-of-network co-insurance, co-pays, deductible, because it may not be worth, you might want that out-of-network benefit, but you may have to spend $20,000 before you're gonna even get close to meeting it. So that would be if you're gonna go to some doctor somewhere who doesn't accept insurance and you're gonna meet that out-of-pocket maximum. So that's a deeper discussion, so I wanna keep you guys awake. So as I was saying, you have the out-of-pocket maximum, so that's the deductible, the out-of-pocket maximum here, the deductible, the co-pays, all of that applies to that out-of-pocket maximum. So the co-pays don't apply to the deductible. They only apply to that out-of-pocket maximum. So when you have co-pays, it takes a long time to meet that deductible. So it's confusing. Health savings accounts. Does anyone have a health savings account? Okay, so the health savings account, you have to have a high deductible plan to qualify for that. So, I didn't check what it's gonna be for 2025. It's about above, it's usually about 1,300 to 1,500 deductible and up. And the plans will say whether they offer this health savings account. So health savings account, you can contribute to it with there's a triple tax advantage. So you can write it off on your taxes what you contribute if you had income, I'm trying to figure out how to say that properly. So if you contribute to it, you can put it on your taxes and write it off. And then you don't take anything out. You don't pay any taxes when you take it out. And it actually you can invest that money and won't have taxes based on the growth of that money that you've invested. So the HSA, what's important with that, you can contribute for the whole family, and it's basically up to $8,200 that you can contribute a year. And there's different rules about when you can contribute. And what you do with the health savings account, you can invest it. That's what you're kind of supposed to do, or you can just use that money to pay for your expenses as they come along. And some of the HSAs are, you can set it up through the company, or you just can go to your own bank and set it up through them and set up an account. Okay, so here's what I was talking about, choosing your plan. So this is where you got, the deductible. Here's a high deductible here. This is the out-of-network deductible. You see the difference of $6,250 for one person, $15,000 for you if you go out of network. So when you're going out of network, that $15,000, you basically have to spend double the amount to get to the $15,000. If you go to a doctor out of network, they bill you $200. So you have to pay that $200. And then you submit the claim to the insurance company. The insurance company says, okay, that's great, we only cover 100 of that. So you basically will have to spend $30,000 before you meet that deductible. So you really have to think about how often you're going to, actually a lot of our clients, there's mental health who they're spending so much money, and that's trying to find a low out-of-pocket out-of-network deductible is really important. And then you have, you may have a different separate deductible for prescription drug coverage. And that can be very important to look at, because it could really impact your premium and your costs. If you have high prescriptions, you want a plan that doesn't necessarily have a separate deductible, because you'd rather have it added into the whole plan deductible. And then we talked enough about the out-of-pocket maximums, but these are the numbers for a high deductible plan that you're looking at. The people who have like a $6,250, they don't have much further to go to the out-of-pocket maximum where the plan starts paying 100%. So I do that, with an MRI, and you have one MRI and a couple of doctor's visits, and you're pretty much at $6,200. And then just looking here at, this is different experiences. This is the high deductible, so you tend to have co-insurances versus copay with a very high deductible, because you're taking kind of that risk, and you're looking at a lower premium, hoping that you're healthy that year. And then again here, this is how the out-of-pocket works, where they pay 50% first after you meet your deductible, and then you have to get to the out-of-pocket maximum to have 100%. All right, so these here in these areas here, these would turn into copays under a plan that has a lower deductible with copays, where you're paying $20 or $50 to go to a specialist. So those plans will tend to be more expensive. But we definitely recommend someone who's going to the doctor all the time, they have some pre-existing condition, they have cancer, they're having treatments all the time. We go with a low deductible and co-insurance or co-pays, because they're gonna meet that deductible, no problem. So why bother doing the high deductible and having to deal with a whole bunch of bills? Okay, enrollment online. Or you can do it over the phone, you can do it with a broker, you can have someone do it for you. As far as doing the enrollment when you're going online, so that we talked about Access Health, you can go online, you have to create a login and ID and password. You can go in and you can search all the different plans there. You may not be able to search those plans we talked about that go directly with the insurance company. So look both places if you don't qualify for a subsidy. You can go through the websites to link back to Access Health, but if you're going to enroll in those plans, you might as well just start with Access Health CT. Once you do the enrollment, you make sure you get confirmation of the change. You should get an email, you get immediately, you'll get documentation in the mail. What we often do is have our clients will get their confirmation and we'll get a confirmation for them just to make sure and get the information in the mail. And then what gets confusing with the payment is when you enroll with Access Health CT online, it takes them a little bit, a couple days to send that over to the insurance company. Then the insurance company will send a confirmation and then you have to pay the premium. And it can take a while, so if you sign up late, you may get that premium bill later than you would like, and then you don't get your ID card, so you have to call the insurance company. So what they do, the insurance companies have a guest portal. So read your mail if you change your plan, because they'll have instructions on how to make these changes and make your payments. And then also it will tell you once you get your ID number, you can register on the website, which I highly recommend it, especially to go and understand your benefits and look at your claims and see how things are being covered and processed. Okay, so we talked about confirming your enrollment, making sure you get your ID cards, carry your ID cards with you at all times with your driver's license. You paid your premium, and now you're going to notify your providers that you've changed insurance. Never assume that because you went to Dr. So-and-so or you were in the hospital that Dr. So-and-so has your changed insurance. It is just, what they'll do is they'll be billing the old insurance company, and you're going to get letters in the mail that it's denied, then you're going to have to call the doctor's office and you have to tell them to resubmit the claim because you have this new insurance. So, as I say, not even for this reason, if you're traveling anywhere, you should carry that card, because if you don't have it, the hospital, whoever, emergency situation, if you don't have it, they may not send the bill to the insurance company, they'll send it to you. And if they don't notify the insurance company in a timely manner, then you have to appeal it and you have to get the hospital and the insurance company to work things out and hopefully get that bill covered. So I've got a lot of stories to tell.
What's a timely manner generally?
Well, a timely manner can be 3 months for a doctor's office, but with hospitals, you may not get that bill until like 3 months later. Because the other thing is with those types of situations, you don't realize it, but they have written in the chart that you're uninsured. So it's a sort of different level of how they're looking at your chart, unfortunately. Have you ever had something like that, Clarissa?
No, thank God. That would
Yeah.
be a nightmare.
Yeah, it's really scary. When this client of mine, he was in Maryland and it was Florida, and the bill came around so late, and it just took a lot of time he had to call us. Paying the premium. So again, as I was saying, you can go in as a guest, just read the instructions, read your mail, call up the insurance company if you haven't gotten anything, just say, I haven't gotten anything, I want to pay my premium, because you want that coverage the first of the month, of the year, depending on when you're making that change. Getting your insurance, if you don't pay your premium, you have a grace period of 30 days. But your chances of being able to reinstate your coverage can be very difficult if you let it go longer. And I had a recent situation where I was talking to someone, the mother was paying the son's premium and her card was canceled. And she didn't think about, you know, the insurance that she was paying for the son. And the son wasn't reading his mail, and then finally read the mail and got the letter that the plan had been canceled because he went to the doctor's. And so it was like 3 months later. So these are just all just follow through. It's very important, and it will decrease, you know, any future stress in dealing with situations that were not managed well. Okay, so as I said, as insurance funny, I'm sorry, but stress caused by trying to figure out your health insurance is not covered by it. And that's it.